You know, over the months, even the years, as we've been covering the story of Louisiana's economy, the question of funding for Charity Hospital keeps coming up.
Well, it's simply a matter of money. In the past 4 years, the dollars available haven't been enough to keep up with the rising cost of health care. In tonight's cover story, reporter Mark Phillips finds that Charity is indeed in critical condition. Mark?
Good evening, Terry and Beverly. There is no denying the need for Charity Hospital. Nearly 1/3 of all the patients treated in our local hospitals are treated right here. Tonight, we'll focus our report on those who know this place the best: the doctors, the nurses, and the patients.
Do you have chest pains?
Do you need a blood pressure cuff?
You have to check his vital signs before you give him medication.
You have to be fast to keep up with Margaret Leonard, a chief nurse on Charity's 5th floor.
We're stretching ourselves to the limit, and we've been stretching ourselves to the limit for over 2 or 3 years now.
On this day, Margaret and the 15 nurses she supervises have their hands full. There are 102 patients to care for. Most are very sick.
I thought she was going to ICU.
No, I think that the beds are full up there.
For a hospital which could use 1,000 nurses, Charity barely affords the 680 it has. An anticipated $3.5 million deficit forced a hiring freeze. More cuts are expected in March.
If we drop our census, you're going to go back to 1960, 1940, wherever that was at, with rollers stretched out in the emergency room.
There are 44 clinics in Charity Hospital, and some, like obstetrics and general medicine, already treat hundreds of people each day.
They can't pay their rent. How can they pay for medicine or health care?
Dr. Deidre Musgrove is about to meet Mary Cassard, a 56-year-old grandmother from Marrero.
Mary Cassard to the back desk.
Just one thing, your appointments are for 8 o'clock. You have to leave like 6 if you ride a bus to get on this side.
I'm Dr. Musgrove.
It is almost noon before a doctor can see patient in the busy general medicine clinic.
Straight in 27. She's had diabetes for about 15, 16 years.
I couldn't afford the private doctors, so I came over here.
Mary has a job, but she is among a growing number of Charity patients who can neither afford the cost of health insurance nor qualify for Medicaid. Charity treated 300,000 people last year and received nothing for it.
I don't have to do this forever. I'm going to do this for 3 years, and then after that, I'm going to pay for the bills I made while I was a resident that I couldn't pay then.
Do you work?
No.
But as the economy continues to lag, Charity is forced to bear the greatest responsibility for providing health care to the indigent. 6-year-old Danielle Sawyer needs a hernia operation. Her parents are separated. Both are unemployed.
Just an estimate amount of the hospital bill based on your income. You would not be billed, and you would not be billed, and you would not be billed, and you would not be billed.
Maintaining adequate or even improving health care delivery while not going broke doing it is the challenge that faces officials here at Charity and as well state government. Tomorrow, that'll be the subject of our next report. Beverly, Terry?